Obsessive Compulsive Disorder, OCD, features a pattern of unwanted thoughts and fears known as obsessions. These obsessions lead you to do repetitive behaviors, also called compulsions. These obsessions and compulsions get in the way of daily activities and cause a lot of distress. Obsession symptoms. OCD obsessions are lasting and unwanted thoughts that keep coming back, or urges or images that are intrusive and cause distress or anxiety. For example, fear of being contaminated by touching objects others have touched, doubts that you've locked the door or turned off the stove, images of driving your car into a crowd of people, thoughts about shouting obscenities or not acting the right way in public. Compulsion symptoms. OCD compulsions are repetitive behaviors that you feel driven to do. These repetitive behaviors or mental acts are meant to reduce anxiety. For example, hand washing until your skin becomes raw, checking doors over and over again to make sure they're locked, counting in certain patterns, silently repeating a prayer, word, or phrase. Treatment include combination of antidepressants and psychotherapy to improve quality of life.